You guys are doing well. So today we will talk about biofeedback and using the electromyographic biofeedback. So EMG is what we are going to be focusing on. That's how it's typically used in the clinic. Here is our outline that you can read for yourself and our introduction to biofeedback. So what biofeedback does, it provides information about physiological or biomechanical processes that can be acted on for improved function and performance. It requires action by the user, so that means they have to contract their muscle themselves and relax themselves, and it just is a picture of what they're doing. So as they contract, there are impulses that the machine measures and gives you feedback. So it's unlike other physical agents, there is not energy transfer to the targeted area. It is just recording what you are doing. It's giving you input about what's going on internally. So there are two types, direct and transformed. Now, the types, the way that those are classified is kind of giving you a picture of how accurately the information produced by biofeedback reflects what's going on internally through the biological processes that are being recorded. So direct would be the most accurate recording of what's going on internally. So it's a numerical value of the processes. So an example is like a heart rate monitor. So every time your heart beats, it records, the number of beats, and the number that you get is the direct number of beats that your heart actually made during that time frame. Transformed is a representation. It's a signal of muscular electrical activity. So like an EMG. So as you contract, it doesn't count how many fibers exactly contract, or it doesn't give you a picture of what a muscle contraction looks like. It gives you kind of a physical representation of what the muscle contraction is. So if it's a larger contraction, then it might be a larger amplitude picture on the EMG versus if it's smaller, then it might be a smaller amplitude. So it changes based on what your muscles are doing, but it's not directly an exact number or exact representative of what's going on inside the body. An EMG device is typically used in the clinic because it's portable. It allows for audio and visual representations of the muscle activity. It records the ionic activity in microvolts, and settings typically range from 1 to 2000 microvolts. The gain setting, that determines the device's sensitivity or ability to reflect that ionic activity. So the higher gain setting, the smaller changes in electrical activity to produce EMG signals. And we'll mention this again on other slides, but if someone has a strong muscle, you may have to turn the gain down so that you're able to see differences in their muscle contraction. If they have a very small muscle contraction, like maybe just a twitch, or maybe there's some significant weakness in that muscle, you may have to turn the gain up to be able to record any impulses at all, so that it's more sensitive to even slight impulses and still records even small muscle contractions. With biofeedback, here are some terms to know. Peak amplitude. This is the highest EMG activity during a muscle contraction. So when your muscle is like fully contracted, that is that peak amplitude. Contraction latency is how much time it takes from resting or baseline to reach that peak amplitude. So if you're at rest and then you try and contract your muscle, how long it takes before it reaches that full contraction is the contraction latency. The return latency is how long it takes to return from the peak amplitude to baseline or to a resting state. So after a muscle contraction, how long it takes to go back to rest. The hold capacity is the time during a consistent EMG amplitude. It basically measures your endurance. So it measures how long you can hold or maintain a muscle contraction. The threshold is, so here it says goal level of activity set by clinician. That's kind of the book's definition. It's essentially the level of electrical activity required to produce a signal during biofeedback training. So the threshold is how much electrical activity is required to create a signal. All right. The return latency is typically around a second. The contraction latency typically takes around half of a second. So it takes about half a second for you to fully contract and about 1 second to fully relax. If you have longer return latencies, then that reflects that your muscle is having a hard time relaxing, that it is staying contracted. And you may have to do some inhibitory biofeedback, which we'll go through in a minute. Okay. Oh, the threshold is used to um to determine, like, if somebody you're wanting to facilitate a muscle contraction, you would tell them to try while they're contracting to get it above the threshold. So you would kind of show them, I want it to look this large, or I want it to be able to record this much amplitude or to like how much, kind of so they can visualize how much they need to reach. And every time they contract, they're trying to go above that threshold. Versus if it's inhibitory, then when you're relaxing, I want you to be below this threshold. So that's used in biofeedback to kind of give them that input that they need to determine if they need to contract harder or relax more, or how they need to grade those muscle contractions. This is an EMG device, and it's labeled. The label A up here is just your on-off switch. B right here on both leads. So these larger A and Bs in the middle of the machine are the two different electrodes that they're measuring. But the B on the side goes from the red all the way to the green. It shows you the amplitude, how large of a contraction they are demonstrating. C up here is the gain, so you can turn it up or down to make it more or less sensitive to those changes in muscle contraction. D is the volume that you can turn up and down. And then E right here shows you the threshold. So that yellow line in the middle that has black arrows pointing at it shows you the threshold. And so if they're trying to keep it above the threshold, then you would instruct them to try and keep it in the green while they're doing the activity. If you want them to do it for inhibition and you're trying to help them relax more, they would want to keep it in the red during periods of relaxation. All right, I've already said that. So if the machine doesn't detect a muscle contraction, then you could turn the gain up in order to be more sensitive and detect even a smaller muscle contraction. And then as they get stronger, you can turn that gain back down in order to detect, differences in muscle contraction. And that's called shaping, when you're changing the gain based on their improvements or their needs as they progress throughout treatment. Shaping. All right, some of the physiological effects. So it provides feedback to a user on their voluntary alteration of activity based on myoelectrical activity. So it gives the patient feedback on their muscle contractions, their voluntary muscle contractions. There are three primary uses for biofeedback, which are neuromuscular facilitation, inhibition, and coordination. We'll go through each of those. With facilitation, so this combats arthrogenic muscle inhibition. So arthrogenic muscle inhibition means that your muscle is getting an inhibitory signal telling it to not contract, to relax due to pain or injury. It's a protective mechanism that is trying to protect that area. So AMI is the abbreviation for that. And it's inhibition of normal muscle function due to pain and swelling. So With neuromuscular facilitation, we're trying to reduce this arthrogenic muscle inhibition in order to increase a muscle's ability to generate force. So with neuromuscular facilitation, we're trying to decrease muscle inhibition to increase contraction. As the patient is performing an activity, they're trying to keep that contraction above the threshold. Okay, and some of the benefits of this is it can lead to greater force production, earlier gains in range of motion and function after a surgery, decreased latency of motor unit recruitment, increased neural excitability, and voluntary activation. Those are the benefits of using neuromuscular facilitation with biofeedback. With inhibition, this decreases tone due to activation of fewer or smaller motor units. So we're trying to get more inhibition and decrease excitability of the muscle to be able to relax more. So you would use this during relaxation techniques, during postural training, like if they have tight muscles that are creating postural changes, abnormalities, and to decrease excessive muscle tone. They're also the patient's instructed to keep it below that yellow line, below the threshold during the times of relaxation. And some of the benefits of the neuromuscular inhibition are to help decrease pain, decrease muscle tone, increase function, and then increase range of motion and flexibility. With neuromuscular coordination, this improves timing and recruitment of muscle activities, same thing. And the emphasis is on correcting the timing and the intensity of the motor unit firing. So we're not changing something by like E-stim. With neuromuscular E-stim, we're trying to increase the motor recruitment physiologically through electrical stimulation. Here, what we're trying to change is the timing and the intensity so that the patient is more able to control what their muscles are doing. So increase that awareness of what's going on during activities and help them to be able to fire the neurons when needed, to recruit more motor units, to relax in between sets, and to have that awareness to increase the function. And it can be used with musicians, athletes, with patients who have neurological injuries, in a variety of patient settings. Some of the indications to use biofeedback are hemiplegia or any type of general weakness, especially with quadriceps strengthening. Headaches, it has been helpful in decreasing symptoms from headaches. Pelvic floor disorders, especially with stress incontinence, where it's difficult to keep from peeing on yourself whenever you laugh or sneeze or jump, especially in women who have had children. And then chronic pain disorders, it can also be used, and with temporomandibular disorders. So that's like an umbrella term for TMJ problems with the joint here in your jaw. Some of the contraindications and precautions with EMG biofeedback: you cannot use it over acute fractures, over severe muscle strains, or if they are allergic to the adhesive that you use. The intracavity sensors, so those are like the needles that you place and do biofeedback that way, would be contraindicated during pregnancy or bladder or vaginal infections, or within 6 weeks of a pelvic or rectal surgery. Typically, those needles are placed down there in the pelvic floor, and so that's why all those are related to pelvic floor issues. Some of the adverse effects: skin reactions from the electrodes can happen, and then there could be responses to cardiovascular and strengthening exercises. So, like if um, the patient has some type of heart issue or something like that, they may just have a reaction to the exercise, is basically what we're saying. It wouldn't be anything more with the biofeedback than if they were just exercising without, but they could get tired, short of breath, have chest pain or other heart conditions with the activity that they're doing based on what activity you have them do with the biofeedback. To apply biofeedback, first you have to clean the area. You want to remove hair, maybe need to remove dead skin cells. Clean it with an alcohol wipe or something to make sure it's sterile. Then determine where you want the electrodes placed based on the target muscle. It needs to be parallel with those muscle fibers. If you need to secure them with tape or with an ACE bandage or something to make sure that they are secure on the patient's skin, then do that. Um, the book recommended using like a little dab of ultrasound gel before you put them on. Then once the electrodes are placed, you want to establish a baseline while the patient is at rest, which is shown to the left, but it's covered up with our words. I don't know if you can see that clearly. And then you would have them, you would set the threshold and you would have them either contract the muscle or go through an activity or relax, depending on what you're using it for and what the goal in mind is, and then assess your outcome. Some of the things that you would need to document when you use biofeedback is the goal of the treatment, the area that you're treating, how you prepared the patient, where you placed the electrodes, what you determined to be that threshold and their baseline and their peak amplitude, so that you know for future reference, the latency and treatment duration, your parameters, the patient's position, and the response to treatment. And that's really all there is for biofeedback. So um, we can talk about this and go through this more in the lab. And if you have any questions, just let me know.